Before we get started, this podcast is for educational purposes only. It is not medical advice. Always consult a qualified healthcare provider before beginning or changing any supplement, peptide, or medical routine. Today we are going to explore Melanotan 2, a synthetic peptide that has gained attention for its unique effects on skin pigmentation, appetite, and even sexual function. Over the next few minutes, we will dive into what Melanotan 2 is, how it works, its history, the science behind it, potential benefits, risks, side effects, common dosing practices, and what people need to know before ever considering its use. Let's start with the basics. Melanotan 2, often shortened to MT2, is a synthetic analog of the naturally occurring melanocortin peptide hormone alpha-melanocyte-stimulating hormone. That natural hormone plays a role in stimulating melanogenesis, the process where your body produces melanin. Melanin is the pigment responsible for the color of your skin, hair, and eyes. By increasing melanin production, MT2 essentially encourages the skin to darken or tan. This is one of the main reasons people are interested in it. Now, how is Melanotan 2 developed? Researchers at the University of Arizona were originally looking for a way to reduce the risk of skin cancer. The idea was that if they could stimulate the body's natural tanning process, people might not need as much UV exposure to achieve a tan, and less sun exposure could mean lower cancer risk. While the compound did indeed stimulate tanning, researchers quickly noticed some unexpected effects such as changes in appetite and sexual arousal. So how does Melanotan 2 actually work inside the body? It binds to melanocortin receptors, particularly the MC1 receptor in skin cells, leading to increased melanin production. But MT2 also interacts with other melanocortin receptors including MC3 and MC4. These are located in the brain and can influence appetite, metabolism, and sexual function. That's why some people report decreased hunger, weight changes, or increased libido when using it. Now, let's talk about why some people use it. The first and most obvious reason is skin tanning. Users often report developing a darker, more even tan with less time in the sun. Some also claim that it reduces the risk of burning, though this does not mean someone can avoid sunscreen or safe sun practices. Another reported benefit is appetite suppression. Some users notice they eat less when using MT2. That has drawn interest for potential weight management, though this effect is not consistent, and it is not approved as a weight loss therapy. Perhaps one of the most unexpected effects is related to sexual function. Many people report that MT2 increases libido or enhances erectile response. This was so notable that it actually led to the development of another peptide drug called bremelanotide or PT141, which is approved in some places for treating sexual dysfunction. But of course, with potential benefits come risks. One of the most common side effects is nausea. Many users feel queasy, especially after the first few injections. Some experience flushing, facial redness, or lightheadedness. Another well-known effect is that existing moles and freckles may darken. Some people even report new freckles appearing. This raises concerns because darkening moles can sometimes resemble warning signs for skin cancer. Because of this, anyone with a history of melanoma or skin cancer should be extremely cautious and consult a professional. There are also other possible side effects including fatigue, spontaneous erections in men, and changes in blood pressure. The long-term safety data is limited, because melanotan 2 has never been officially approved as a prescription drug for general use. Most of the use comes from research peptides sold online, which means purity, dosage, and sterility can vary widely. Speaking of dosage, what do people typically use? While not approved, anecdotal reports suggest users start with a very small dose, often around 0.25 milligrams, and gradually increase depending on their tolerance and goals. Some people continue with maintenance doses once they reach their desired skin tone. Injections are usually subcutaneous, meaning just under the skin. But again, dosing practices vary because this is not a regulated medication. Now, let's look at some of the science and studies that have been done. Research has shown that MT2 does in fact stimulate melanin production and tanning. In clinical studies, participants developed significantly darker skin with less sun exposure. In studies on sexual function, MT2 and its derivative PT141 showed promise in improving arousal and erectile response. Appetite reduction has been reported, but studied less thoroughly. Despite these findings, safety concerns remain. Because MT2 is often purchased from research chemical suppliers, there are questions about contamination, inaccurate labeling, and unknown long-term effects. Some health authorities warn against using it outside of research settings. Now, let's go deeper into the mechanism. The melanocortin system is fascinating. There are 5 known melanocortin receptors, numbered MC1 through MC5. MC1 is responsible for pigmentation. MC3 and MC4 are involved in energy homeostasis, appetite, and sexual behavior. MC5 plays a role in exocrine functions like sweat and sebaceous glands. When MT2 binds to multiple receptors, it explains the wide range of effects people report. Another interesting aspect is the difference between melanotan 1 and melanotan 2. Melanotan 1, also known as afamelanotide, has been developed as a drug called CNS, which is approved in some regions for patients with a rare condition called erythropoietic protoporphyria. That condition makes people extremely sensitive to sunlight. By darkening the skin, afamelanotide helps them tolerate more light exposure. Melanotan 2, however, was never developed into a licensed drug because of its broader receptor activity and side effects. Now, let's address a common question. Does MT2 protect against skin cancer? The answer is complicated. By increasing melanin, it may provide some additional protection against UV damage, but it does not make someone immune to sunburn or skin cancer. Safe sun practices like sunscreen, protective clothing, and limiting UV exposure are still critical. Another question people ask is how fast results happen. Many report that tanning develops more quickly when using MT2, even with minimal sun or tanning bed exposure. Some users notice changes in skin tone within a week or 2. The appetite and libido effects can also appear quickly, sometimes after just 1 or 2 doses. Let's also talk about the method of administration. Since it is a peptide, MT2 cannot be taken orally because it would be broken down by digestion. That's why injections are the standard route. Some vendors offer nasal sprays, but absorption is much less reliable compared to injections. Now, as with any substance that affects multiple systems in the body, there are groups of people who should avoid it. Anyone with a personal or family history of melanoma or other skin cancers should not use MT2. Pregnant or breastfeeding women should not use it. People with cardiovascular conditions or blood pressure issues should be very cautious. We should also highlight the legal and regulatory status. Melanotan 2 is not an FDA-approved drug in the United States. In fact, its sale for human use is generally not legal, though it is widely available online as a so-called research chemical. This gray market nature increases the risks because there is no quality control or oversight. Now, let's discuss some real-world reports. Many users describe starting with low doses to avoid nausea. Some find that injecting before bedtime helps them sleep through the nausea period. Others combine the peptide with brief sun exposure to accelerate the tanning effect. Reports vary widely, which reflects how differently each person responds. On the other side, there are cases where people developed concerning side effects like darkening moles, prolonged nausea, or blood pressure changes that force them to stop. Without medical supervision, it can be risky to identify when a side effect is dangerous. Looking at the bigger picture, MT2 represents both the potential and the challenges of peptide therapy. On one hand, it clearly demonstrates how targeted peptides can influence multiple body systems. On the other hand, it shows the importance of proper testing, regulation, and medical oversight before a compound should be widely used. If you are listening and curious about peptides in general, MT2 is a great example of why research is important. Just because something produces a visible effect like tanning does not mean it is safe or appropriate for long-term use. Let's summarize what we have covered so far. Melanotan 2 is a synthetic peptide that stimulates melanin production, leading to tanning. It was developed with the idea of reducing skin cancer risk by lowering the need for UV exposure. It also affects appetite and sexual function through other melanocortin receptors. Benefits include tanning, possible appetite suppression, and enhanced libido. Risks include nausea, mole darkening, potential cancer concerns, cardiovascular changes, and the lack of regulation and quality control. As with all peptides, purity, dose accuracy, and individual health factors play a huge role in how someone might respond. Because it is not an approved drug, its use is experimental and carries significant uncertainties. Before we close, remember again that this podcast is for educational purposes only. It is not medical advice. If you are considering any peptide, including Melanotan 2, you must consult with a qualified healthcare provider to understand the risks, potential benefits, and safer alternatives. Thanks for listening, keep learning, and stay curious.